In the second segment, we're going to be focusing on cardiovascular disease, which is going to be abbreviated as CVD. So cardiovascular disease is a disease of the heart and blood vessels, and it kills almost 1 million people annually. So it's the #1 cause of death in the United States. The heart is one of the least regenerative organs, meaning whatever sort of damage is caused to your heart at any time is permanent. It's not reversible. We often hear that cardiovascular disease or heart disease is going to be more prevalent in men, but it's actually the #1 killer of women. So it doesn't discriminate against your gender. Atherosclerosis is really the root of cardiovascular disease, and atherosclerosis is the hardening of arteries, and everyone has signs. So you're not protected from atherosclerosis. It doesn't matter how healthy your diet is or how unhealthy your diet is. Everyone is going to have some hardening of arteries. This actually begins in childhood. But what we are concerned about is how advanced the hardening of the arteries is. So the advancement of the disease is what we get concerned about. So as the arteries harden, we have this plaque formation. And most people have this well-developed plaque by the age of 30. So remember, plaque development or this hardening is going to begin in childhood, and plaques are well developed by age 30. And then just as we age, they keep developing even more. Diets high in saturated fat are a risk factor for promoting further plaque formation. And then these other factors listed here can also cause inflammation of arteries, which are all related to this further plaque formation and hardening of arteries. So things like having high LDL cholesterol, as we learned previously, high LDL, or LDL is our bad cholesterol. So we want to keep it as low as possible because high LDL increases the risk for heart disease. Hypertension, which is high blood pressure, can cause inflammation of arteries. We'll talk about hypertension in our next segment. Smoking can cause stiffening of arteries and makes it really hard for the blood to flow. High blood levels of homocysteine, and then certain viral or bacterial infections can also cause inflammation of arteries. So these several images are just show you how plaque formation develops, and we'll go through the specific steps of plaque formation. So you can see here we have a healthy artery and then a damaged or a diseased artery with plaque. Here you can see the normal artery, the blood, it can easily flow through, whereas when plaque has started to develop, this narrows the artery, and then once it's closed off, this can cause stroke. And this again shows the development of that plaque over time. So what's going on? How does this plaque form? So inflammation, as we talked about, which is a normal response to any sort of injury, causes the immune system to send white blood cells, or those macrophages, which are the ones that are going to engulf whatever is there. So macrophages are going to remove the oxidized LDL, which is what's causing that inflammation. So the macrophages engulf the LDL, and then they become what's called a foam cell. The foam cells then also become oxidized. So this is going to attract more white blood cells. So we have this continuous process of inflammation going on. So more and more red blood cells are coming. They're forming these foam cells. The foam cells then get oxidized again. More white blood cells come. So it's just this constant attraction going on. So as these cells all come together and there's more and more coming, then this plaque starts to form. And the muscle cells of the arterial wall divide in this attempt to try to heal the damage. They mix with the foam cells, and then this is what's going to form this hardened plaque, as we can see here, we can see here, we can see here. And then the mineralization increases the hardening of plaques. So it's okay as long as blood can still flow through here. But when this plaque closes off completely, that's when we need to become even more concerned. So what happens when this gets completely blocked off? Well, the plaque can actually rupture. So a spike in blood pressure, which could be caused because that artery may be closed off, or if there's some other spasm in the body going on, any sort of disruption can cause a rupture, essentially. And the body's going to respond by sending platelets, which are clotting mechanisms, to clot the blood, so to stop the bleeding. So what happens is that then there's a thrombus that's formed, which is a stationary clot that closes off the blood vessel. So it's basically, you can think of it kind of like the Band-Aid. So it's going to prevent the blood from flowing anymore or losing, any sort of excess blood. So that's okay for now. So it's stationary. But this can become concerning when an embolus forms. And so an embolus is the thrombus is going to break loose and it's going to basically get stuck in the artery. So this, you might have heard the term embolism. So during an embolism, the embolus gets stuck, and then this can lead to a heart attack, stroke, and excessive bleeding. We have also heard about aneurysms, which is a ballooning out of brain of an artery wall. So you might hear about a brain aneurysm. So there's a rupturing there, and this can often cause death as well. So while clotting is a very normal response, when clotting is abnormal, this can be life-threatening. So it's kind of like the immune response. It's a very normal process, but if that happens too much over time, then this can actually damage cells. So the same thing is going on here. We want our blood to clot so that we don't, bleed out. But over time, we could have these embolisms going on. So there's some positive and negatives going on there as well. Talk about some cardiovascular disease risk factors. And we talked previously, there are some risk factors that can be modified and some that can't be modified. So we have our modifiable and non-modifiable. So with cardiovascular disease, let's start with our risk factors that cannot be modified. So age obviously cannot be modified. And risk of cardiovascular disease increases with age. For women, it increases over age 55. Or after age 55, the risk increases more, and for men, it's after age 45. Males tend to be affected more, but remember that it does not discriminate, and that cardiovascular disease is also the #1 killer of women. So males tend to have a higher risk, but it does not discriminate between genders. And then genetic inheritance. So cardiovascular disease does run in families, and if you have an immediate family member that had cardiovascular disease or some related disease, then this increases your risk as well. So this is why it's important to know your family history and then get your own lab results checked out. So what are some factors that we can modify ourselves? And all of them that are going to be in orange are going to indicate something that is diet related. So you can modify these through your diet. So LDL and HDL cholesterol. So remember, increased LDL and decreased HDL are going to be something that increases your risk for heart disease. So we want our LDL to be low. We want our HDL to be high. High blood pressure or hypertension also increases the risk for cardiovascular disease. And actually, hypertension and atherosclerosis worsen each other. So high blood pressure can cause arteries to further become stiff and weakened. And then we know this could lead to the high blood pressure and then increased risk of stroke as well. And this increases the strain of the heart. So by increasing the blood pressure, remember that this can cause the rupture of the plaques. So not a good thing. So high blood pressure and CVD or atherosclerosis are very interrelated. So it's very important to manage those two things. Diabetes. For individuals that have atherosclerosis and diabetes, atherosclerosis progresses very rapidly. This can block blood vessels and also decrease circulation. So not a good thing going on there either. We already talked about obesity being related to many other chronic diseases and actually being a promoter of other chronic diseases. So managing weight is very important. Physical inactivity. So we know physical activity has many health benefits, and one includes it can help to decrease your risk of heart disease, but it stimulates the development of new arteries. It really keeps your heart healthy. Cigarette smoking can increase blood pressure, but it also increases risk because of all the toxins that are being presented to the body, which can increase inflammation and oxidation as well. And then we have what's called an atherogenic diet, which is what a lot of people consume, which is a diet that's high in saturated fat, high in trans fat, high in cholesterol, and then this in turn, all of these can increase LDL cholesterol, which is not a good thing either. So it's really important to focus on a healthy diet full of whole grains, fruits, vegetables, lean protein, and low-fat dairy. So what are some recommendations for reducing cardiovascular disease risk? First is to implement dietary changes. So we always want to try to manage a chronic disease by our diet or lifestyle first, and then if that doesn't work, that's when medications may play a role. So always remember that use your diet or lifestyle as the first line of defense. So decrease saturated and trans fat intake. So we've talked about sources of both of these before. We want to increase grains, fruit and vegetable intake, specifically whole grains, and focus on complex carbohydrates. And all of these are going to have fiber as well, which can help decrease cholesterol, which would in turn help decrease cardiovascular disease risk. And then increase fish intake to 2 times a week. So fish can help decrease inflammation, decrease triglyceride levels, and prevent clots through the action of omega-3 fatty acids. It's also important to increase physical activity, as this can help to, again, manage body weight. We talked about the other benefits of physical activity for the heart, help or lose or maintain weight. So it's very important to, if you're obese, to decrease your weight to reduce your risk of cardiovascular disease. And then if you smoke or you're around a lot of smoke, reduce exposure to tobacco smoke, as we know that this increases the risk for cardiovascular disease as well. So you really want to limit your exposure to whatever other toxins are out there.